السلام عليكم ورحمة الله وبركاته. طلاب المرحلة الرابعة الأعزاء، رمضان مبارك عليكم، وإن شاء الله يزيل هذه الغمة عن هذه الأمة. بإذن الله ترجعون تنورون مقاعدكم الدراسية وتنهون هذه السنة الدراسية بنجاح باهر بإذن الله تعالى. Our lecture today will be on a pre-term labor. محاضرة مهمة جدا. Very common to be seen such patient in our world in the obstetric unit. فلهذا أريدكم تنتبهون عليها هواية وتركزون عليها. Before to start for the definition of a preterm labor, we should understand that in pregnancy, term refers to the gestational period from 37 week to 41 week plus 6 weeks. يعني أي مريضة أقل من 37 أسبوع she is a preterm. نحفظ هذا التعريف كل الزين، نفهمه كل الزين. إذن 37 week plus 0 she is term till to 41 plus 6 weeks. After that she is post-term. So preterm birth is defined by the WHO as the onset of regular uterine contractions associated with what? Associated with cervical effacement and dilatation occur between 24 week and 36 week plus 6 days. هذا كلش مهم. إذن مو فقط بين هو regular uterine contraction و associated with what? With a cervical effacement and dilatation. And the period is between 24 week and 36 plus 6 days. ليش قلتوا لي 24 week؟ بس واحد يسألني يقول لي دكتورة why we say 24؟ Because any effect or any delivery or anything occur before this gestational age report to as miscarriage. alright زين؟ فقبل 24 اسبوع هو miscarriage، بعد ال 24 اسبوع صار preterm labor. Furtherly subdivided into a mild preterm اللي هم من 32 لحد 36 plus 6. Very preterm infant defined as those born between 28 and 32 weeks, and extremely preterm infant defined as those who deliver or born before 28 weeks. The incidence of the preterm birth in the developed world is thought to have increased over the past decade, with an estimated annual incidence of 10 to 15% of all live birth. طبعا هذا الكلام in our societies will be طبعا more. Okay, what are the sequelae of preterm birth? وإذا أجى الطفل قبل موعده, is there any effect? Yes. The adverse outcome in the terms of morbidity will include, first of all, neonatal RDS, respiratory distress syndrome. The cause of the respiratory distress syndrome is the highly membrane disease, which occurs due to inadequate production of surfactant by the type 2 alveolar cells. What else? Necrotizing enterocolitis and its sequelae of septicemia, diarrhea, intraventricular hemorrhage, periventricular leukomalacia, jaundice, retinopathy of prematurity and neonatal hypoglycemia. Long-term problems include cerebral palsy, deafness, visual impairment, developmental delay, and bronchopulmonary dysplasia. Now, is there any etiology for the preterm labor? Yes. مهم نعرف شنو الأسباب حتى نمنعها على الأقل، أوكي؟ أو نقدر نعالجها حسب الكوز مالتها. For the etiology of the preterm labor, first of all, genital tract infection. There is a strong correlation between infections within the uterus and the onset of spontaneous preterm labor. Bacterial vaginosis and Chlamydia trachomatis have been shown to increase the rate of preterm labor. Ascending infections from the genital tract can result in intrauterine infection and chorioamnitis if it may exist with or without fever, leukocytosis, uterine tenderness, fetal tachycardia, and also maternal tachycardia, or any of the classical signs of chorioamnitis. If amniocentesis is performed in preterm labor with an intact membrane, 10 to 15% of the samples will result in a positive culture. بيقول لك يعني احنا لو روتينلي سوينا immunosynthesis راح نشوف 10 15% of the samples will result in a positive culture. So, genital tract infection is very important cause of preterm labor. What else? Maternal infections. Example, pyelonephritis, pneumonia. In the developing world, malaria is an important cause of preterm labor. Placental abnormalities, which include either in the morphology, in the implantation, or function. It is a common with the placenta previa. Anatomical abnormalities of the uterus, for example, خلينا نقول septate uterus, whatever, 1 to 3% and could be congenital, septated, or acquired, like for example, leiomyoma. Cervical surgery can cause also preterm labor. For example, عندنا الcone biopsy. Fetal pathology, uterine overdistension in multiple pregnancy in polyhydramnion, cervical weakness. مثل ما قلنا either it is a congenital cervical weakness or acquired because of vigorous curettage, cone biopsy, okay? Idiopathic, which is represent 20 to 30% of the cases, مهمة هاي تحفظوها, and 30 to 40% of the cases of preterm birth are iatrogenic. يعني احنا نسوي البريتيرم بيرث، احنا اللي نقول مثلا patient عندها severe hypertension, preeclampsia, HELLP syndrome, and we should terminate her pregnancy preterm. Okay? خاف أحد يعرف شلون يصير iatrogenic و other causes. Social and epidemiological risk factors. There are certain risk factors that may motivate you to keep in touch that this patient will have a preterm labor. There are a non-modifiable risk factors and there are a modifiable risk factors. Non-modifiable يعني قصدي أني ما أقدر أبدا شنو أقللها. It is a non-modifiable and can be subdivided into a major and minor. الميجر non-modifiable risk factors وراح أعيد وأقول these are risk factors not a cause, risk factors. First of all, last birth preterm 20% risk. يعني a patient had a history of a preterm birth. إذا آخر واحد هذه 20% الريسك فاكتور راح يصير عندها إنه هذا البرجنسي أيضا احتمال يصير preterm. لكن if she had last 2 birth preterm 40% risk will be increased. 20 pregnancy بحد ذاته 50% risk. Uterine abnormalities مثل ما قلنا septate uterus, unicornuate uterus, cervical anomalies, cervical damage because of cone biopsy of repeated dilatation, fibroid خاصة cervical fibroid, factors in current pregnancy اللي هو recurrent antepartum hemorrhage, intercurrent illness like for example sepsis, pneumonia وغيرها, any invasive procedure or surgery. These are non-modifiable major risk factors. While the non-modifiable minor risk factors include the teenage age, having second or subsequent babies, parity كانت برايمي or multi grand multipara أكثر من 5, ethnicity دائما نشوفها هاي بالبلاك women, poor socio-economic status, education not beyond secondary يعني ما مكملة. While the modifiable risk factors, smoking, ليش قلنا modifiable? We can change it. For example, the smoking, twofold increase the preterm labor. Drugs abuse, especially cocaine, body mass index أقل من 20, underweight woman, يعني اللي هي ضعيفة كلش, enter pregnancy interval less than 1 year. فالinter pregnancy less than 1 year, smoker, drug abuse, body mass index مالته قليلة, هذه modifiable risk factors for preterm delivery. Now, عرفنا الاتيولوجي، أخذنا نظرة على الريسك فاكتورز. Now how can we manage the patient؟ انتبهوا علي، المانجمنت راح تتقسم عدة أقسام سواء كانت البيشنت symptomatic or asymptomatic. راح نتكلم أول شيء عن المانجمنت of asymptomatic high risk women. طبعا prediction and prevention of preterm labor. Ideally, women should be seen postnatal and the event leading to their preterm birth should be reviewed. There should be a clear management plan for any subsequent pregnancy. Advice to stop smoking, leaving at least 12 months between pregnancy and dietitian advice. What are the investigation treatment during pregnancy to prevent preterm labor? First of all, early dating scan. First trimester ultrasound, very important for dating of the gestational age, knowing any abnormality in the placenta, in the fetus, okay, in the uterus, very important. Second, bacterial vaginosis. Treatment can be given in the form of oral metronidazole, which significantly lower the risk of a preterm birth in high-risk women positive for bacterial vaginosis. Asymptomatic bacteria should be treated also, investigated and treated. A group B streptococcal colonization has been linked to the prematurity. A preterm infants are more susceptible to have early onset of group B streptococcal infection acquired during the passage through the birth canal. High-risk women for preterm labor are tested for GBS antenatally, allow appropriate intrapartum prophylaxis to be planned. راح واحد منكم يسأل يقول دكتورة ايش ما ذكرتيها من ضمن الانفكشن؟ جروب بي سيبتوكوكال از يعني اذا اني اسوي سكرين فور افري وومن كلهم راح يطلع عندهم تقريبا. هل هو يفيدني انه يقلل الانفكشن وما راح يقلل الانفكشن؟ لكن الهاي ريسك وومن اللي هي هاي احتمال يصير عندها بريتيم ليبر، لا، البيبي هذا حيكون بريتيم، immunity مالته تختلف، كل شيء يختلف بيه، فلهذا it will be worthwhile انه اني شنو اسوي screening for it and treat the patient while she is pregnant to prevent its long-term sequelae. Cervical ultrasound. طبعا لازم الcervical length of 15 to 20 millimeter or less at 20 to 24 weeks predict 50% risk of preterm delivery prior to 34 weeks of gestation in a low risk population. أخذت هذه المحاضرة عن use of ultrasound in obstetric ومن ضمنها كان measuring of cervical length very important. Fetal fibronectin testing. Fetal fibronectin is what? Is a glycoprotein which is present in the amniotic fluid, in the placenta, and the extracellular substance of decidua. The presence of fibronectin in the vaginal secretions between 20 week and 36 week may be used to predict the risk of preterm labor. Fibronectin testing may be used to assess risk in asymptomatic women at a high risk of preterm labor. تجيك البيشنت كلها بدنا نحكيها انه هي patient asymptomatic لكن she is a high risk، عندها major مثلا او minor non-modifiable risk factors او عندها modifiable risk factors. high risk patient. okay. cervical sarcollage. Sarcollage may be used ربط عنق الرحم. Sarcollage هو ربط عنق الرحم. Sarcollage may be used in women who have a history of recurrent mid-trimester loss and are diagnosed with an incompetent cervix. لازم أني cervix مالتها قلنا اللينث أقل من إيش قد 20 ملم، هذا خلاص should be offered for cervical sarcollage. Women are identified during sonographic examination to have a short cervix. We can do also rescue cercollage. شنو هذا rescue cercollage؟ rescue cercollage هذا نسويه مو بس الاسيمتوماتيك women، حتى symptomatic woman إذا جتي هي she have cervical dilatation she had short cervix شافوا إنه نقدر نسوي rescue circulage rescue يعني إنقاذ نسوي rescue circulage نقلل البريتيم ليبر إيش تقللها شافوا فقط يقللها 50% 50% احتمال تتوقف و50% تستمر أوكي بروجستيرون طبعا ما يخفى عليكم البروجستيرون will act as a uterine quiescence يهدئ اليوترس فإذا راح يخفف من اليوتراين contractions okay and can prevent the preterm labor lifestyle modification in the form of stop smoking dietitian for low birth weight إذا هي قاعدة تاخذ drugs cocaine abuse or else she should stop it okay نيجي على البارت المهم جدا اللي هو المانجمنت of symptomatic women يعني treatment of established case خلاص أنا هذه diagnosed her she having a preterm labor شلون احنا سوينا لها diagnosis by examination by cervical vaginal examination abdominal examination and vaginal examination and we diagnose her to have a preterm labor مثل ما قلنا preterm labor irregular uterine contraction and cervical dilatation and effacement don't forget these words. First of all, evaluation should include determination of the following. Gestational age. Gestational age must be between 24 week and 37 week. أو خلينا نقول 36 plus 6 days. Which should be calculated based upon the patient last menstrual period. وشو تعتمد عليها إذا كانت period regular, not lactating, not taking contraceptive pills. If known or a previous sonographic estimation if these dates are uncertain. ثانيا, I should evaluate for the fetal weight. Care must be taken to determine the fetal size by ultrasonography. حاليا شافوا إنه fetal weight is very good for determination of the gestational age. Presenting part. The presenting part must be noted because abnormal presentation is more common in early stage of gestations. Fetal monitoring, continuous fetal monitoring should be performed to ascertain fetal well-being. Investigations and laboratory studies. Complete blood count with differential يعني أنا أسوي لها complete blood count يتضمن قلنا احنا الهيموغلوبين والوايت بي سي كاونت والديفرنشال وايت بي سي كاونت كلها لازم اعرفها very important platelet count urine analysis culture and sensitivity testing speculum examination should be performed cervical cultures should be sent for gonorrhea chlamydia a wet mount should be sent forward to look for signs of bacterial vaginosis. Group B streptococcal infection culture should be taken from the vaginal and rectal mucosa. Ultrasound examination for the fetal size, position, placental location, cervical length by transvaginal ultrasound should be done. Normal cervix measures 35 mm in length. Cervical shortening is accompanied by dilatation and funneling of the membrane down of the cervical canal. Hematological workup and associated with vaginal bleeding يعني إذا عندها vaginal bleeding أدزها blood group prepare blood هاي very important fetal fibronectin مثل ما قلنا and amniocentesis. What are the next steps after I do this investigation? Will depend on the following. First of all, the degree of cervical dilatation, duration of the pregnancy and estimated fetal weight, the condition of the fetus and the mother, and any associated medical or obstetrical condition. تمام طلاب؟ فإذا هسه أنا سويت كل الانفستيجيشن اللي أريدها، حصلت الاي دي الكرايتيريا مالتي، راح أعتمد على شنو؟ أعتمد على الديجري اوف cervical dilatation، على الديوريشن مال البريجنسي، الفيتال ويت مالتي، the condition of the fetus and the mother in general or any associated medical or obstetrical condition. First group راح نقسم هسه احنا اكو جروبين. راح نقسم الفيرست جروب هو انه I will allow the labor and delivery to proceed. وين؟ شوكت وكلش انتبهوا على هذه النقاط. اولا the cervix is 4 cm or more dilated. خلص هذه دخلت بالاكتف phase of labor. مو طلاب 4 cm dilated. اذا I should allow. Membrane are ruptured. خلاص. Mother has an acute medical or surgical condition such as thyrotoxicosis, heart disease, okay? Mother has temperature more than or equal to 38 centigrade or other evidence of symptomatic chorioamnitis. Tenderness, tachycardia, maternal or fetal tachycardia, C-reactive protein positive, okay? Fetal demise, IUD, what you are waiting for. Fetal congenital anomalies incompatible with the life. Allow for the delivery. Severe fetal distress خلص هذا ما راح يتحمل. Severe IUGR intrauterine growth retardation or restriction. Maternal hemorrhage example apraxia placentae, placenta previa, DIC اللي هو disseminated intravascular coagulation. Severe preeclampsia estimated fetal weight أكثر من كيلو ونص خلص. adequate fetal lung maturity أنا سويت له aminocentesis وقسته وعرفت إنه البيبي هذا عنده good lung maturity خلاص. Allow for the delivery to proceed. عرفنا الفيرست جروب. السكند جروب اللي هو منه I try to inhibit the preterm labor when the membrane are intact, when the gestational age is less than 34 weeks, when there is no overt maternal or fetal infection, when the cervix is less than 4 cm dilated. هسه الحكي هنا. What are the treatment options? Treatment of patient with established preterm labor will include, first of all, maternal steroid. The administration of the corticosteroid is very important to accelerate the fetal lung maturity, which has become the standard of care in the United States for all women at risk of a preterm delivery between 24 weeks and 34 weeks of gestation. Steroid can be given according to one of the two protocols. أولا إما نعطيها بيتا ميثازون 12 mg IM every 24 hours for a total of 2 doses or dexamethasone 6 mg every 12 hours for a total dose of 4. حفظوها البيتا ميثازون 12 mg IM كل 24 ساعة أو أنطي الدexamethasone 6 mg IM every 12 hours. Antibiotic. Patient with preterm labor should be started with on antibiotic for a prevention of the neonatal GBS infection if the patient is GBS positive or if she is unknown. ما سويت لها ما تعرف. خلص انطيها. Penicillin, ampicillin is used as a first line treatment. Cefazolin, clindamycin إذا كانت patient allergic, erythromycin, حتى vancomycin can be used if the patient is allergic to penicillin. If the patient is successfully tocolyzed and يعني tocolyzed يعني توقفت الليبر ماكو عندها contractions and there is no sign of imminent delivery, GBS prophylaxis can be discontinued. Okay? نيجي على الموضوع المهم جدا 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 اللي هو التوكوليتيك. توكوليتيك هواية عندنا items. أول وحدة وأهم وحدة هو الأوكسيتوسين ريسبتور أنتاغونست الأوتوسيبان. الأوكسيتين ريسبتور أنتاغونست هذا يعمل يعني يشتغل عكس عمل الأوكسيتوسين. الأوكسيتوسين يسوي لنا يوتراين كونتراكشنز، هذا الأوتوسيبان بالعكس يوقف اليوتراين كونتراكشنز. very beautiful drug لكن الادمنستريشن مالته يحتاج فد تايتريشن معين حتى نستخدمه. الكالسيوم شانل بلوكرز النيفيديبين ادلات موجودة هواية available. المغنيسيوم سلفيت which can be also used to treat eclampsia إذا تتذكرون. الانتي بروستاجلاندين اللي هو الاندوميثاسين. النيتريك اوكسيد دونر اللي هو الجليسيريل تراينايتريت. البيتا سيمباثوميمتيك. واخر شيء الريتودرين وجماعته سالبيتامول وغيره. If a tocolytic drug to be used, Otosiban or nifedipine appear to be preferable as they have a fewer adverse outcome or effect and seem to have a comparable effectiveness in the terms of delaying the delivery for up to 7 days. Ritodrine, the beta agonist, it's no longer used صراحة no longer used because side effect مالتها كلش قوية. Their use should be now be completely abandoned. Okay. Risk of tocolytics. البيتا اغونست تسوي لنا التالي، طبعا هاي انتم تحفظوها تفهموها تجينا هواية أسئلة عليها. البيتا agonist it will cause palpitation, tremor, nausea, headache, chest pain. Pulmonary edema is a well-documented complication usually associated with aggressive intravenous hydration, hyperglycemia and hypokalemia. الاندوميثاسين شو يسوي؟ على الماتيرنال يسوي لنا بيبتيك ألسر، bleeding, thrombocytopenia and allergic reaction. لكن الفيتال والنيونيتال it will cause pulmonary hypertension secondary to closure of the ductus arteriosus, necrotizing enterocolitis and intraventricular hemorrhage. Magnesium sulfate it will cause adult respiratory distress syndrome, respiratory depression, cardiac arrest and low therapeutic ratio. يحتاج titration، يحتاج monitoring، كلش مهم. Now انطيت انت البيشنت التوكوليتيك، الاوتكم شنو؟ If it is successful then transfer the patient to the antenatal ward, require absolute bed rest to start, then bed rest with a bathroom privilege. يعني أنا أخليها أول شيء bed rest completely، وراها أحاول أخليها إنه تتحرك حركة بسيطة وألو normal diet. لكن if the tocolytic is not successful after 6 hours، انتبهوا عليها طلاب 6 ساعات شفتوها بعد الكونتراكشن مستمرة there is a progressive cervical dilatation then you should contact labor and delivery. Premature infant less than 34 weeks should be delivered in a hospital equipped for neonatal intensive care unit whenever possible, sorry, because transfer following birth is more hazardous. يعني انت قاعد مثلا خلينا نقول في مستشفى ما بيها intensive neonatal care unit، ابد لا تخاطر وتحاول انه to proceed for the delivery because the neonate will be loose، راح ينتهي من عندك. حاول تنقل المريضة إلى مستشفى equipped for the neonatal care. It's very important. خلصنا محاضرتنا لهذا اليوم، أتمنى أنه تكونون استفادتوا. Any question I am ready to answer it. Thank you for your listening and have a nice day. Thank you very much.